Okay, welcome back. Now, chapter 2. In chapter 2, we talk about many of those prefix, right? Yeah. So, first, let's talk about hyper and hypo. Theoretically, I think in English, why I always change it down? But in English, should be hyper and hypo. That's the uh, that's the way of how to say this two words in regular English. However, hypo, especially in the daily conversation, it's very easy to confuse these two words. So, in many cases, when we say hyper, we just still say hyper. It's the accent, the accent is here. But when we see hypo, you put accent here. So hypo is easier to recognize it. Hyper means high. Hypo means low. So in this case, it's hypertonic means in and versus hypotonic. When we say hyper and hypo is higher and lower, it's always by comparison. One reagent compared to another reagent, one side compared to another side. And for example, inside the cell versus outside the cells, and inside the blood versus outside the blood vessels, or inside the lumen, outside the lumen, within the urine versus blood, etc., etc. Always, whatever we using hypertonic and hypotonic, we always mention two bodies to compare. Hypertonic means with higher solute concentration. What is solute? The salt or anything dissolving water is solute. And hypotonic is low solute concentration. And maybe have learned osmosis. Osmosis is talking about, diffusion. Diffusion means this is the fundamental law of the physics. The solute always travel from hypertonic to hypotonic. However, water travel from hypotonic to hypertonic. And water is a special diffusion of, this water diffusion have a special name called osmosis. Osmosis water diffusion. But just keep in mind that osmosis, because I mentioned this because I noticed I watched some YouTube videos trying to say the osmosis, the opposite direction, the diffusion reason is totally wrong. Diffusion is always from high concentration to low concentration. We talk about hypertonic, it has high solute concentration, and hypotonic has low solute concentration. But when you're talking about this solvent, because water is called solvent, the solvent concentration is the lower on the hypertonic side and higher in the hypotonic side. That's what water coming from the hypotonic side to the hypertonic side. And iso always means equal. If you heard of isotope, isotope means the two atoms have the same number of protons. It's called isotopes. And iso means equal, and isotonic means these two sides of a membrane or two solutions have the same concentration, same solute concentration. Let's move on. Why? Okay, did it. Let me get right. And hyperglycemia. Glycemia. Yeah. Hyper means high. Glyc means glucose. Cemia means Mia means emia, not mia. Emia means in blood. And then hyperglycemia is high blood glucose or high blood sugar. Glucose is the type of a sugar that is transported inside the blood. Hyperglycemia, chronic hyperglycemia, that's diabetes. So chronic hyperglycemia can cause many consequences. For example, higher risk of cardiovascular disease, higher risk of kidney diseases, etc. However, acute hyperglycemia happens all the time. It's not that dangerous. Yeah, so on contrary, hypoglycemia is low glucose in the blood. And low glucose actually in some cases even worse than it can possibly pass out other people. And some people die of hypoglycemia. And in case of diabetes, not only is chronic hyperglycemia, and also it can also cause acute hypoglycemia. This diabetes is a loss of control of the glucose level in the blood, and hyperventilation. And hyperventilation is the fast respiratory rate. Yeah, very fast. It's normally caused by triggered by some stimulus and etc. In most cases, it's not a big deal, but normally is I put something here. More than 20 respiration, inhale, exhale is considered a hyperventilation. But hypoventilation is not defined by how many respiration cycles you can have per minute, but rather is defined by SO2. Oxygen saturation in the blood. It's less than 90%. That's hypoventilation. Hypoventilation is another thing that's very dangerous. And I think less than 80, you have to see a doctor immediately if the oxygen saturation in the blood. What is oxygen saturation in the blood? And hemoglobin. Hemoglobin carry oxygen. 90% means 90% of the hemoglobin carry oxygen. So we have to maintain our blood. In the blood, more than 90% of the hemoglobin carry oxygen to maintain a normal activity. And then with this, we call it physiological level. Anything we call it physiological means the normal level. So then next, hypertrophy. Hypertrophy means grow. Hypertrophy. Grow. Excessive growth. Trophy means grow. High. Much growth. Sometimes it's good. For example, if you want to build a muscle, hypertrophy is good. However, sometimes in other cases, hypertrophy is not necessarily good. And say hypertrophy of fat is not good, right? And then in some cases, for example, there's a later we talk about acromegaly, the actual growth of the other soft tissues, and it is a disease. So hypertrophy is just growth. It's not that good or bad. And let's move on to the next word. Isometric. Interesting. Isometric. Isometric. What does it mean? In isometric, in those cases, refers to the muscle. So, for example, this is a table, and I'm standing beside the table, trying to. This is my hand. This is my arm, trying to lift it. Okay. So, at the beginning, no one will use a full strength to lift the table, right? At the beginning, I use a small strength to lift the table, but it doesn't move. Since it doesn't move, I give more and more strength to lift the table. And then this is an angle here at the same time. But eventually, this table is so heavy. I was not able to lift it at all the whole time. So even though my strength increased gradually, my strength become higher and higher and higher, but this angle this upper arm and the lower forearm and upper arm, this angle does not change at all. This is called isometric. The angle does not change. However, the strength becomes stronger, isometric. And keep moving. Intravenous. Intra means inside. Intra means inside. Intravenous. Venous means the vein. Inside into the vein. And it can be anything can be used to describe anything that means anything inside the vein. However, in most cases, it means an injection. Intravenous injection or IV. This IV injection is, let's say, I guess maybe some of you will never do IV injection, but I guess many of you have done this. Just insert a needle into the vein, IV, and then compared to IV injection, there's a really okay. That's the next chapter. We have more about this different administration of the drugs. So intraocular, again, intraocular, inside. Ocular means the eye. Intraocular, inject something into the eye. And not really inject, it can be used to describe something already inside the eye, but also it can also be used to describe the administration of inject something into the eye. So intraocular. For example, there's an experimental approach being in the clinical trial nowadays to inject islets into the eye to treat diabetes. So let me see what's next. Intracellular and extracellular. Cellular means inside or outside the cells. Intra inside cells. Extra outside the cells. Not much to say. And the intrauterine. Intrauterine, again, I mean, they can be used to describe anything inside the uterus. Uterine means uterus. And however, in many cases, it refers to the intrauterine pregnancy, which is good. Intrauterine pregnancy is good. And I think we are going to talk about this in some places later, which are actual uterus pregnancy, which is bad. And the baby cannot survive. You have to use surgery to remove it. So we done with intro. Now next let's talk about inter. Inter we use, I guess in the language we use like word like international, internet. What is inter? In between things, outside, between two things. So say interstitial. Interstitial means between tissues or between cells. Our tissue or our cells stay in our body, but it's not always bind to each other for all the time. They are fluid existing between tissues, and that's called interstitial fluid. And interstitial fluid originally coming from the blood, and they are later drained by the lymphatic system. So interstitial is a word we'll use a lot. So, and then intervertebra. Intervertebra. West spine. Spine. We have, this is probably the vertebra, the body. And we have 33, and then 34. Never mind. So our spine is not one. It's not one bone. One bone. Okay, and it contains 33 called vertebrae, and vertebrae means vertebral bone or vertebrae. That's the bone. Okay, and then why our spine can bend? Because what is this? Between this called intervertebral disc, and this intervertebral disc they are flexible, make us capable of bending. And then some people have a degeneration of this intervertebral disc, which is the number one cause of disability in the US. Let's keep moving. Oh yeah, that's it for inter. Let's keep moving to the next. What's the next? And endoderm. Okay, this is a little. So our embryo, at a certain point, the embryo will develop into this, we call it rastulum. I believe so. But anyway, so in the center, there's this have two cavities. So this we call it amnion, and this is the yolk sac, and in the center, this is the real embryo, and the real embryo have three layers. The first, this layer, this called it ectoderm, and the ectoderm will develop into skin and nerves, and the whole nervous system. In the middle, this is called mesoderm. Mesoderm will lead to blood, bone, muscles, etc. And then the lowest part I use green here. This one, endoderm. And endoderm develop into guts and lung. So this is a very, very critical stage of the embryonic development. So yeah, that's it. So now we describe the ectoderm and endoderm, and then so endo means inside. So endoscopy. Endoscopy is similar to colonoscopy. Colonoscopy is to check the colon by inserting, say, this is the mouth and esophagus, stomach, small intestine, and colon. So colonoscopy, this is colonoscopy. And the endoscopy is coming here to check the esophagus and the stomach, whether there's anything wrong there. And so it's an endoscopy, okay, are we done with endo? On another, endometrium. Endometrium. There's a special, say, this is the uterus, and the inner layer of the uterus we call it endometrium, and inside the uterus. Any more endo? I think that's it. That's all for endo. It's now, let's say, next, let's talk about, ectopic. Ectopic means somewhere something happened, not in the original place. And when I was in graduate school, my study is one of my research gene therapy, and we use a lot of ectopic therapy to, for example, people like some genes. The gene was originally expressed in the liver, but we deliver some of those DNAs into the muscle to let us, for example, coagulation factors to be expressed in the muscle. They call it ectopic expression. In that time, ectopic sounds a good word for us. However, ectopic maybe good or maybe bad. For example, let's we talk about ectopic pregnancy. And I'm trying to draw something. I'm trying to draw this is the uterus, and this is called a fallopian tube. So in the best condition, a baby best grow here. And this called, we just mentioned, intrauterine pregnancy. However, the in the pregnancy, the embryo should migrate from here, the fallopian tube, to the uterus. If it attached the fallopian tube and look at the uterus, this is called ectopic pregnancy. And here, the fallopian tube cannot support the baby to grow. And when the embryo grows too big, it may cause a serious internal bleeding. It may be even life-threatening. So embryos grown here have to remove with ectopic pregnancy. And now we see a new patient. Epi. So epidermis. Dermis means the skin. Epi means above. Above the skin. The skin has largely three parts. This is epidermis, this is dermis, and this is a subcutaneous. So epidermis, that is the very topical part of the skin. And this part has only mainly one peptide called keratinocytes. I'm not sure my spelling, but something. So, and there's no blood vessel here. Anyway, this is the very top. So if you ever, like say, cut your fingers, cut your palm, if you see a cutting, but there's no blood, means it's only cut it into the epidermis, but not inside the dermis. And epiglottis is the cap. Say this is the vocal, this is the larynx, the vocal box, and then behind the larynx, this is the esophagus, and then this larynx has a cap, which is epiglottis. In general, epiglottis is open so let the air get in. However, when you eat, this epiglottis closed, the larynx, so the food get into the esophagus when you eat and drink. So this epiglottis is switch between breathing and eating. And epineurium. Nerve as this is the epineurium, basically the outermost layer of the nerve. It's more complicated because nerve is bundled is axons. I've heard axon before. Axons is very long, and the different axons bundled together to form nerves. And nerves are organized in a very special way. Several axons bundled together to form a vesicle. And there's, let's see, I'm not really sure, but I believe shouldn't be blood vessels in the vesicle. And then different vesicles all further bundled together with the blood vessels to form a nerve. And each of those layers have some membrane enclosed it. And the very outermost layer is called epineurium. Next, let's talk about more about this membrane thing. So another thing is the Para means surrounding something. Paramysium. Paramysium, my, in most cases called muscle. Sim, membrane, and surrounding the muscle membrane. So paramysium is the outermost membrane to enclose each of the muscles. So this is the to enclose the muscle, membrane. So, and periosteum. Periosteum is the bone membrane. Many of those our organs, especially structures in the body, are enclosed by membranes. Perimysium encloses the muscle. Periosteum encloses the bone, and epineuron encloses the nerve. And then it's called pericardium. Pericardium. The heart is also enclosed by a membrane of pericardium, but if the pericardium different than this and this because pericardium have two layers of membrane there. And then whenever the heart is pumping, you don't feel the friction because all of those frictions are lubricated by between the two membranes. Where's my between the two memories. And what else? Okay, let's do a new chapter. Another chapter. New page. Aplastic. So A means no. There's no just mean no. No plastic. Plastic means changing or generating. So no generation. A plastic in many cases is always anemia. And aplastic anemia is a bad form of anemia because it means this body cannot generate enough red blood cells or other blood cells. So why they cannot generate new blood cells? Because our body needs to constantly generate new blood cells. For example, red blood cells, they only survive about 120 days in our body. Every day we generate a lot of red blood cells. And then why those people cannot generate new blood cells? Many reasons. One reason is the radiation. So this happens. May happen to people that receive the cancer therapy. Apnea means again no. Apnea always related to lung. So apnea is not no lung but no respiration, no breathing. In most cases, it's not serious. It's only temporarily lack of respiration for some reasons. Yeah, let me see. Aphonium. No, again, phonium. Same as phone. Speech. Cannot speak. This is not really. It's a little bit. What's the word? It's different than the condition that's loss of capability of language capability. It's more like no sound, cannot make a sound. For example, larynx. In most cases, the larynx problem with laryngeal actually remove the larynx. It can just generate this condition. And okay, yes. Next, last one, dice. Dice is many things. Whenever it starts with dice means malfunction, a malfunction doesn't function well. When I start with dice, it doesn't seem to be very good conditions. For example, dice menorrhea. Menorrhea means menstrual cycle. Menorrhea means the blood that is being shed during menstrual cycle, and dysmenorrhea. Menorrhea means a painful or right ramping. It's most cases a triggered by more than normal, stronger than normal contraction of the uterus to generate this pain. And what's the next one? That's laxia. Oh yes, this is the one. That's laxia. This is a laxia. This is a neural problem. So we talk about the aphonia is the respiration, the trachea, not trachea, the larynx problem. The dyslarynxia, that is the neural problem. That's no language. Can make it a sounds, no language. So and then last one, that's the this is a difficulty in breathing. Is A, B, yeah. And apnea is in most cases not very serious. It's only temporary, involuntary stop breathing, but dysphonia is may reflect to something wrong with the heart, with the lungs, and dysphonia. Okay, I think that's it for this chapter. See you next time.